Welcome to the Your Drama This Way podcast, where we have meaningful discussions on the challenges in healthcare and the solutions behind them. I am your host, Liz Church. Each episode, we dive into the complexities of our health and social system, gaining the experiences and insights of the guests that shape our lives and our communities. Today's episode, we're going to be diving into a crucial aspect of public health that affects all of us: data integrity. So, earlier this season, we talked about data quality, data literacy, but we are going to dive deeper into what defines data integrity. So, accurate data is the foundation of effective public health policies and interventions. Now, whether intentional or accidental, data manipulation can lead to misguided policies, harm communities, cause confusion, and lead to resource misallocation. So we're going to explore handling raw data precisely, ensuring accurate connections, and the ethical approaches to necessary, correct, flawed data. My guest today is Raina Sharma, a senior advisor to a dramatist and data strategist with extensive experience in public health, analytics, surveying, database management, and health IT. Raina has assisted organizations including Maryland Department of Health Contact Tracing Unit during the COVID-19 pandemic in managing contact tracing technology. Her expertise in data collection, strategy, analysis, and product management of data platforms, combined with her background in epidemiology and analytics, provides valuable insights into the importance of data integrity and the processes necessary to ensure accurate and reliable public health data. Without further ado, Raina, welcome to the show. This is fantastic to have you here.
I'm excited to be here.
So, to start our conversation, can you share your journey into public health and data analytics with us?
Yeah, I was thinking about this question earlier this week, and I've been in public health, I think, for forever. My dad was a professor at the University of Pittsburgh School of Public Health, so I've been learning about it for forever. And that's kind of how I decided to go into it, was because of him. So I got my MPH in epidemiology a while ago, and I started out my career at the Army Public Health Command doing behavioral health work, which was like coming out of a master's program and going into this job was probably one of the coolest things ever, because we basically took the outbreak investigation format for infectious disease and applied it to behavioral health. So, I got to travel, which, at that age was like the dream. But I also got to do every type of data collection and analysis that I think like you can really do. So we did surveys. We looked at all the types of administrative data we could get, which included healthcare claims, but all the drug testing and any other surveys that soldiers get during their time. And we also worked with a qualitative team who did interviews and focus groups. So it was mixed methodology, and it was just like such a great intro to the data world. And I think it actually might be like my favorite job to date. But, once I was done with that, I didn't really know what to do, but I thought maybe getting into the IT world was kind of the next great step. And so I ended up at a health IT company who was working for or with a health information exchange. And I've been more or less in that world since, in some way or form. I will say that I did take a short break from the public health world right before the pandemic, and I was working for a video game company, but data and analytics focused the whole time. We collected data on basically everything a player does in a game and use that to make decisions. And that was a great place to learn about distilling data and like analyzing large amounts of data. But also making sure you're collecting the correct things about the players to actually answer the questions you want. So I learned a lot there that I was still able to apply to public health. And then when the pandemic happened, as an epidemiologist, I just had to get back into public health. And so I came back to manage the technology platform that the Maryland Department of Health used for contact tracing. And once again, like it was, not only a platform used by contact tracers to collect information, but also like it was a data platform. It was collecting, storing, and then using the data too. So once again, data was at the center of all that. And when that was over, I decided to kind of, use all the skills I've built up and consult on my own. And I focus on analyzing data and building analytics platforms. So it's just been a constant. I think data has just been constant in my public health journey.
And it's amazing that you've gone through different avenues, because I don't know if I really need to share your resume with everybody when we go live with this, but it's amazing how you jumped from being in public health, doing different things with data analytics and measuring, and it's really cool to read your resume and
Oh,
see how
thank
you
you.
did jump from public health to the video game world and then back into public health. It was kind of like you found your calling to come back. It was like
Yeah.
the global pandemic was like, okay, they need me, I gotta go with the other superheroes and take some stuff down.
Yeah, unfortunately, like I feel like as an epidemiologist, even though, I never really worked in infectious diseases a lot, I feel like that's what you kind of train for, unfortunately, is something like a pandemic. And so it, I just, there was no way I couldn't not go back into it. You're right. It was
Mhm.
really just like a calling.
Yeah. And once we find our calling, then it's like, okay, we got to find our meaning to stay in it, if that makes
Yeah.
sense. So I feel like we're seeing, like with what we're seeing with a lot of people in navigating their career paths, the workforce shortages, the problems that we're having.
Mm-hmm.
It is really hard to stay in it. So I have to commend you for staying in it. I know you're not like at the front lines as a practitioner or anything like that, but like still there is a toll that it does take,
Yeah.
and there's a lot of strength in being able to stay in it and understanding the work that you're doing and why you're doing it.
Yeah, no, I agree with you. I think too, we also just assume that like your career trajectory is always going to be linear and you're always going to be, kind of, it's going to seem to make sense. But I think we also forget that we can take positions to build different skills and then come back and put them all together.
Mm-hmm.
I think each position and job that we have has a lot of skills and a lot of things that we can learn from it. Doesn't mean we always need to be like, working kind of up the corporate ladder or something like that, but we can always keep learning. And,
Mm-hmm.
I think taking a little break and then, remembering that like, while I love video games and I still do, I think coming back was that opportunity to bring everything I've been learning into one space and be like, okay, like this is, I think, where I'm supposed to be.
Mm-hmm. Mm-hmm. It's a very interesting dynamic because when you were talking about climbing the corporate ladder, I realized like I didn't want to do that. I wanted to be able to do something that gives back, and
Yeah.
where I find my place, that it's for the mission that I'm doing, not for the potential growth from it, from like based off like income or title or prestige or anything like that. So
Yeah.
yeah.
Yes. Yeah. It's funny you mentioned title. Someone just sent a document around this morning and was asking if everyone's title is correct. And like, my title is totally wrong, but I was like, I don't know what it should be because I'm one of those people where it's like, I don't care about the title. I care about what I'm actually doing.
Yeah.
I think like, sometimes we do get tied up in that because there's the societal pressure and like the contracts around, what you do and your title and what that means. So it's
Mm-hmm.
easy to get lost in that sometimes.
Yeah, absolutely. And I agree with that. And we can totally do like a segment on that if you want to, after we have this discussion, you want to
Yeah,
come back, we can
sorry, didn't
talk
mean to
about
get off
this.
track.
But no, it's so easy to do, but it's so true. But moving onward, and earlier this season, I had the pleasure of talking with Angie Grover with Metopio about the benefits of having data at your fingertips. And when you and I were talking for this to build this conversation, we were talking about how accurate data is often described as the backbone of effective public health initiatives.
Mm-hmm.
So, Raina, can you elaborate on why good data is crucial for public health?
Yeah, I mean, and I'll just say, like, good data is crucial to every industry, because everybody's using data to make decisions. But I would say, in particular, if we're bringing it back to public health and healthcare, it's incredibly important because the decisions we're making affect patient outcomes. It can affect how patients are receiving care, or maybe funding to a certain program or something like that. So it's incredibly important to have good data. But I'd say before thinking about why it's like crucial and critical, I'd also just like to take a second to define what good data is. And so, like some of the things that pop into my head, and this isn't an exhaustive list, I think it's just some of the things, to mention is, is the data complete? Is it consistent in how it's collected and what it's collecting? Is, especially, if you have the same fields from across the system, and maybe there's multiple hospitals sending the same fields. Are they all filling it out the same way? What does that look like? Is it accurate? Is it valid? Is it relevant? And, like, is it representative of the population? And is your sample large enough? So, like, I'm just thinking, like, while we all have different definitions of good, and I think, that, like, really depends on what you're doing. But I would just say, like, keeping in mind of some of the things that make data good. If we don't have good data, then we could be making conclusions about things that aren't necessarily true. So, for example, if I ask an ambiguous question in a survey, like, do you always check your cell phone? I'm going to guess people are going to say no most of the time because they're like, I'm not always on my phone. So maybe you're not really getting at what you want. So maybe the question needs to be something more along the lines of, how often do you check your phone? Is it every hour, every 10 minutes, whatever that is, to really get at the question that you're answering. Because if you don't, then you're not going to be able to actually answer whatever the question is from the data. And so, I think making sure we have the correct data is critical to answering the question. I'm just thinking of something I was working on recently. Let's say Department of Health wants you to do a study on all the hospitals in the state, but only 60% of the hospitals are sending data. Can we actually answer what all the hospitals are doing in the state? The answer is no, because we may be missing data from a critical hospital system, or maybe some of the rural hospitals. Let's say we're missing all the data from them. We can't really give a full picture of the situation. So I do think, having good data ensures that we can really answer a question appropriately.
Yeah. And there's so many things that I think of when you're talking about how granular you are in your data collection. And for a class project when I was in college, we had to do, it was for marketing to Generation Z, and like how we had to frame our questions. And my teacher was always getting on students saying, like, you need to be granular because everyone's going to say yes to this. And then there's the other facet of when you're collecting data, if you make your questions very vague, you're going to get the same answer for each one. You're not going to actually get genuine responses at that point. And the interest is not going to be there at all. So there's that as well.
Yeah. I think in surveys, wording your questions it's critical because, you can also ask leading questions, right? You could also accidentally kind of bias your question, and then you're going to bias your answer. And so you're not going to be able to use that information. So it'd be something like, I don't know, don't you think smoking is bad for you? I don't think anyone would ever use that, but that's a leading question, right? Because you're already kind of implying that smoking's bad. And so I want you to say, I want you to agree with that question.
Yeah.
So you're putting bias into the question. And so that's just not going to give you the answer, the truth of how that person feels, because they're probably going to just want to go ahead and answer it how they think you want them to answer it.
Handling raw data obviously can be pretty challenging, especially when ensuring its integrity. So what are some of the biggest challenges that you've faced ensuring data integrity during your projects? And you don't have to name anybody in particular, but just references maybe.
Yeah, I mean, I think one of the biggest challenges that I face is not having control over how the data is collected or sent to me, and kind of having to figure it out. But I do also enjoy the challenge of figuring it all out. But it's definitely hard when, you're kind of at that space of, here's all this data, and you haven't actually been the one to, let's say like with the survey, I didn't actually get to set it up. I had no control of the questions, and it sounds like it may be kind of an intrusive questionnaire. Like they're asking a lot of detailed questions, and sometimes people don't like that. So they could skip entire sections. And so I think there's sometimes some, frustration with that. But I do find that if, you kind of just be flexible and do your best to use the data to answer the question. And so, like one of the examples I could think of right now is I work a lot with ADTs, which are admit, discharge, and transfer data, which are sent from healthcare organizations like hospitals from their EHRs to us. And while there are standards, they're not always followed. But there's also, maybe potential. There's a difference in how data is collected and put into the EHR. And so, for example, is race and ethnicity. We can assume that it's always filled out by the patient, but there have been cases where, maybe a nurse fills it out on behalf of the patient, for whatever reason. Or sometimes people hate answering questions about this. And so they may fill it out differently every time. And so you could have one person with, let's say, 10 visits, and for each 10 visits, they have a different race ethnicity that they filled out or that's been sent over. And so how do you deal with that? Because ideally you'd want to have one race an ethnicity on a patient level instead of using a different one every time. And so I think, you kind of have to take a step back and understand that, okay, this happened. How do I deal with it? What type of decisions do we need to make around it? Is it affecting a large percent of people? Maybe this only happens 2% of the time. So it's, we just need to figure out how we want to deal with it and make a decision on it and move forward. But if it's affecting, 50% of the data, and let's say most patients aren't consistently answering that question or have a consistent answer for the question, what do we do? And, that's just a situation where it's out of your hands, but because you're not in control of what happens at the hospital level. So it's, okay, well, what do I do next? How do I handle the data? How do I make sure, I stay true to what the person put in there in the best way, but also, for an analysis, you can't have 10 different responses, so it's just a matter of figuring out what your decision is and how you handle the data on the analysis side.
Whenever you're looking at how data is collected, there's so many ways that it can be done through papers or through like a third-party software. I'm not saying everybody should be using Google Forms, but that's like a platform that comes to mind, How do you navigate? I feel like that's a big challenge, navigating the data coming from different avenues or different streams, if that makes sense. How filtering through that seems difficult to me.
Yeah, it is, because I think unless there is, let's say, like a mandate or maybe like a financial reason to, or something compelling that's going to get people, let's say, to fill in data in a standard way, they may not be compelled to. And I go back to this hospital example because I think it's also really important to see it from the people that work at the hospital. They're super busy. They may not have time to fill out everything in a way that someone like an analyst would like to see it, right? They're going from patient to patient. They have little time, to fill out what they need to fill out. And so they're also doing the best that they can. So I think it's kind of this balance of, I like going back to the hospital example of trying to make it as easy as possible for them to fill out whatever it is that they need to, but also on a level that's going to help out patient care down the line too. So I think there's a balance, but I also do think in some cases there also needs to be a compelling reason for them to do it, especially if, let's say, you're sending out a survey to, all of the public health organizations in your state, and you want to just learn a little bit about how they're using, a particular resource, or like where they're at or something like that, just getting an idea of how they're doing. They may just not have even the resources to fill it out, or just, be like, who needs to fill this out? I think we forget that we may have this great idea on the research end or the data collection end, but we also have to consider the people taking it. And I think that's a really tough part, because we can give them all the information of how we'd like to see it, but are they capable of filling out the data in the way that we would like it? Do they have the resources? Is it something they can even handle on a regular basis, especially if it's sending regular data for whatever project? I don't know. So I think about it from that angle too. It's like not just on setting up the standards, but also setting up standards that are reasonable for the people who need to be doing the thing.
Obviously, doing the thing the right way, for sure.
Yeah.
But one thing that I'm thinking of that it leads into kind of my next question on this is, it seems like, you got to have a lot of procedures in place to ensure that data holds its integrity and it's true. So flawed data is something that's it's a constant challenge. And obviously flawed data can lead to severe consequences. Can you discuss any ethical approaches to dealing with flawed data, like how public health professionals and also other industries can navigate the complexities of correcting data without compromising the integrity of their analysis?
Yeah. So I think if we're thinking about at the beginning of a project, or beginning of setting up whatever data structure it is, I think data governance is incredibly important. So, ensuring you have processes around data and you understand what those are. as an example, like let's say you're doing interviews, just thinking about the interview process. How many interviewers do you have? Were they all trained the same way? Do they have really clear instructions, or are they kind of just allowed to go off the cuff? Because if, they're allowed to go off the cuff, then you just got to note that there could be some differences based on how they do that. So I think just like, data governance, and no matter how you're collecting data, if you're doing it, in a technology sense, like you're collecting data from, let's say, like, video game example from the video game, understand how you're collecting that data, what it all means, how you're storing it, how often it's sent, that sort of thing. So just making sure like you understand what's going on. Duplicates is also important, missing data. And I also think cross-checking, if you can, data with another source is really important as well. So going back to the hospital example, if I, am getting data from hospitals, and let's say I'm getting like admission data, maybe double check that, if I get 100 admits every day, is that matching up to what the hospital also sees on their side? Because maybe they're seeing 120 and it's, okay, well, what happened to those 20 people? Are we just not getting it? What, is something happening during the process where it's just not maybe firing those 20 people? Did the system go down for a couple hours and that's why we didn't get them? So just like, I think any cross-checking you could doing to make sure your data is matching maybe is also really important. And then, once you do understand any issues, being open and honest about it is really important. So making sure that you're documenting all that and you're sharing it with stakeholders. So, we go back to the race example. So let's say we decide to roll it up and just say people who select multiple races, we consider them in a category of multiple races or something like that. Then we need to tell people that's what we're doing. Not assume that they understand that, let them know it's only happened in 1% of the people. So it's a very small amount that we need to just make this decision for, but we needed to do it. So I think making sure your stakeholders know what you did, so the interpretation of this is correct, is also really important. I say also get a good statistician. I laugh about that, but I'm also very serious. They can't fix everything, but I definitely think they can help apply statistical techniques to ensure your analysis is still remains valid. So something like weighting to account for any incorrect proportions of groups who maybe responded to something, or imputing missing data, something like that. So I do think if that's the phase of analysis you're in and, your data's not looking as you expected, I do think having a good statistician is very important. And when you're making those conclusions about the data, make sure it matches the data that's collected. So, if you do have some issues and you can't 100% maybe answer the initial question, what part of that question can you answer? If you miss maybe a portion of a sample, so let's say like you are trying to sample all adult women, but you miss a group of them, say that, I think, and try to understand like why that may have happened. So like if you had let's say a mobile survey that went out to women over the age of 18, but it went up to the age of 100, there's a chance that, maybe some of the older population who may not know what to do with a mobile survey, they may not answer it. So you may not get responses from some of the older population. So it's just kind of knowing like why that may happen, accounting for that, understanding it, making sure your conclusion doesn't include people who haven't responded. So I think like going back to just when you're thinking about the conclusions, just also note that there's limitations in the data too. And then assessing the impact of what those could be as well. So if you, going back to, thinking about your entire group of women that you wanted to survey not responding, okay, well, how does that impact not only the conclusion we can make, but like the decision we're also going to make? So I think, just taking a step back and understanding that and just being, once again, being open, honest about it. And then I think ongoing wise, I think there's a great opportunity to learn from it. And so when you're working on the next project or the next data collection, the next survey, you can kind of make those changes so you're not maybe seeing the same issue over and over again.
It's also defining like what's the purpose, why is it, and so it's so important to gather this information. Like, what are we going? It comes down to that decision making, like you said. Like, what are we going to do with this information once we have the data collected? Like, are we going to be able to move forward with this particular thing that we're trying to do, or are we just collecting data to collect data? I mean, I don't want to say that's really what's happening, but it's just the thing that I thought of. But
well, and I think too, like, part of it is, okay, well, what do you do if you're just handed a flawed data set? How do you handle it?
yeah,
You do the best you can. But if you are able to kind of be a part of the data collection process and setting it up, I think too, the strategy around being able to collect the right data to answer the right questions is also super important. Because like you said, if you're not really sure what you need and you're just collecting data, you end up doing that. You're just getting data for the sake of having data, because when it comes time to answer the question and you hand it over to the person who's going to use the data, they're like, this doesn't answer the question.
yeah.
So I do think like being really intentional up front, if you're part of the process, is super critical as well.
Yeah, I can't say that enough. We can't close on that because that was perfect. I love that. We can't close on that though. I have one more question for you. So as we wrap up our discussion, what kind of call to action would you suggest for our listeners, especially those in public health, to ensure they prioritize data integrity in their daily work?
Yeah, I mean, I just think it's on a daily basis. It's something that you pay attention to, and all the work that you do. It's data integrity is like we were just talking about. It's part of every step of the process. It's not just when you collect the data or when you're analyzing the data. It's when you're setting up collecting the data, when you're thinking about what you need to do. So I think no matter what position you're in, that has to do anything with data. So even if you're a data engineer, you're just maybe setting up pipelines or something like that. Like you're like, oh, I'm not actually dealing with the analysis part of it. But even then, like what you're doing is so important to make sure the data is coming through on a regular basis. Because if it isn't, do you have anything set up to notify yourself so that you can talk to the right people to say, hey, like you didn't send your feed in yesterday or today. What's going on? Is everything okay? Can you resend it, or are we just going to have missing data for 2 days? So I think I think no matter what part of the process you're in, there's always something that you can do to make sure that you're doing the best with that part of the data process to ensure that you're collecting the best data, and really prioritizing that in your work. I really do think like it, and you never know what's going to how what you do is going to help. I think when I was my first project, when I was at the video game company, I was asked to send out a daily report to track a bunch of metrics, like including like kind of the high level KPIs, like how many players come to the game, and like are people doing battles, and kind of the high level stuff, just to make sure that there were no large changes, because there was a game designer who was going in and making some combat changes, and so he didn't want that to kill the game. And so he was like, can you just like send out this high level report so we can make sure things are staying pretty level? And so I did. But not only did that report end up being really helpful for him, it was helpful for the entire company, because we were able to see like on a daily basis what is going on. Because sometimes like there wouldn't be any data, and it was like, what happened? Did something go down? And sometimes like there was an issue in the database, or sometimes there was an issue like on some other side, or I think there were also times where if we put out a new build, there were things that maybe we didn't expect to see that change. So it's, you just sometimes never know like what you're working on to keep track of data, like how that can like, just change the way that you like track and look at things and understand whatever it is that you're working on. I just think like there's so much opportunity when you're collecting and analyzing data to use it to help things you don't really know that are going to help.
Yeah, do good work.
Yeah.
At the end of the day, it's to do good things. Try to do good things with the data that you get. So
yeah, and I do. It's also, I think, being ethical about it too. I think there's so many ways to take data and manipulate it. So I think too, it's like on us, especially in public health, to make sure we're being true to what the data says and what it doesn't say. And sticking to that. I do think that's really important. I know we saw that throughout COVID, how important it was to be open and honest and to stand behind it, even if it wasn't what people wanted to hear.
Mm-hmm. When you see people talking about data collection, you think it's so easy, it's so simple, it's literally 1, 2, 3, but they forget all the facets behind it, being ethical, having the integrity to do the right thing with it. It's a lot of stuff. But it's amazing stuff, and I love that you and I got to talk about it today. So thank you for coming aboard. It's nice to see you.
Yeah, no, thanks for having me. I was excited to do this. It's like I could talk about data for forever. So
we could do it again. We could totally do it again. We could bring somebody aboard and have like a data battle. I don't know. I mean, it's an idea. But really, though, no, thank you so much, Raina. I really appreciate it.
Yeah, thank you, Liz. It was a pleasure to talk to you.
The Andromeda's Way is produced by me, Liz Church. Editorial assistance for this episode was by my fantastic team at Andromeda's. I would like to express our heartfelt appreciation to our guests who've shared their expertise, stories, and insights with us on the podcast. And finally, a big thank you to our listeners. Your support and engagement have meant the world to us at Andromeda's. We're a boutique consulting firm with the imperative mission of creating healthier, more resilient, more equitable communities. I encourage you to connect with us. Let's continue these conversations and work together towards positive change. You can listen to all of our previous episodes on our website, andromedasconsulting.com/andromedas-way. That's ARTOMITOS. We can also be found on Apple Podcasts, Spotify, Amazon Music, or wherever you get your podcasts. We'll see you next time.